Community clinics provide important free medical services in Bangladesh. It's a place where diagnosis is free, medicine is free, and advice is free. However, they suffer from problems such as lack of drugs, lack of trained healthcare providers, irrational use of drugs, and weak referral systems, among other things. At ARK Foundation, we are part of the government's ongoing program to change this. The changes can be seen at one such community clinic in Berua village, 50 kilometers from Dhaka. To reach Berua, you have to drive over broken highways and muddy rural roads. The clinic is well maintained and managed by Shampa Rani and an health assistant, Shamima Akhtar. The first patient, a mother and a child, appear at the clinic around 9:30 a.m. and Shampa offers them a chair and asks who the patient is, the child or herself. It's the child who is suffering from a cough and cold, but the mother too is feeling weak. Using the training Shampa recently received, she checks the child with her stethoscope and advises the mother to treat the child with tulsi juice and come back after 2 days if the condition does not improve. Using the IMCI job aid that was given to Shampa during her refreshers training, she is able to diagnose that the illness is seasonal fever as the child's body temperature is below 99 degrees. The job aid is one of many materials developed by ARK Foundation using WHO guideline. The government distributed this material to 14,000 community healthcare providers. Another one of the patients is 22 years old Sandharani, who is here with her 1-year-old child. Sandha says they have no other options but to come to this clinic for treatment. Although there is another clinic near her house, she prefers to come here because there are more skilled health workers here and medicines here. Later in the day, we visit another clinic where the community healthcare providers didn't receive any refreshers training and had never heard of the IMCI job aid. Compared to other nearby clinics, Shampa's clinic is providing far better services. Shampa says the job aid and refreshers training helped them a lot to provide quality services to their patients. Before the training, she used to give more drugs to patients. Now she examines them carefully and gives drugs only when necessary. Community healthcare providers can also identify the severity of diseases and danger signs using the job aid. And they refer more patients to Upazila Health Complex. Although ARK Foundation is still looking at what makes community clinics effective, 3 things are becoming clearer. Firstly, community clinics needs monitoring by community clinic management groups. Secondly, community healthcare providers need support to develop their skills. And finally, timely supply of medicine is crucial.